The Psychology of Fear, Understanding Phobias and Anxiety. Fear, an emotion as ancient as life itself, remains a pervasive force in the tapestry of human experience. It's an intrinsic, often involuntary response to perceived threats, critical for survival, yet it can evolve into complex psychological states such as phobias and anxiety disorders. The odyssey into understanding these facets of fear is not just a scientific inquiry, but also a profound exploration of the human psyche. Fear is the mind's alarm system, a primal response etched deeply into our neurology. Rooted in the amygdala, a brain structure pivotal for emotion processing, fear triggers a cascade of physiological reactions. These reactions prime the body for action, the quintessential fight-or-flight response. This system, though vital, is not infallible. It can misfire or become overly sensitive, leading to anxiety and phobias, conditions where fear is not a rational response to immediate danger but a chronic, often debilitating state. Anxiety, in its essence, is fear spread thin over time. It's not the acute response to a threat but a sustained state of apprehension, a persistent whisper of unease about potential dangers. This condition can become pathological, morphing into various anxiety disorders, each with unique characteristics. Generalized anxiety disorder, GAD, for instance, is characterized by excessive, uncontrollable worry about everyday things. Panic disorder manifests in sudden, intense episodes of fear, panic attacks, that surge without warning. Social anxiety disorder involves an overwhelming fear of social situations, a dread of judgment or embarrassment in social interactions. Phobias, on the other hand, are fear in a more concentrated form, a potent aversion to specific objects or situations. Unlike the broad, diffuse apprehension seen in anxiety, phobias are highly focused. The fear felt is often out of proportion to the actual danger posed. These are not just intense fears but constitute a complex interplay of biological vulnerability and life experiences. Specific phobias, such as arachnophobia, fear of spiders, or acrophobia, fear of heights, can trigger panic-like reactions and lead to avoidance behaviors that can significantly impair daily functioning. The etiology of anxiety and phobias is multifaceted, involving genetic, psychological, and environmental factors. Genetics can set the stage, creating a baseline susceptibility to these conditions. Personality traits, such as neuroticism or a natural tendency towards worry, can predispose individuals to anxiety. Moreover, life experiences, particularly traumatic ones, can be pivotal. A traumatic encounter with a dog, for instance, can sow the seeds of cynophobia, fear of dogs. Equally, witnessing a loved one struggle with fear can inadvertently teach fear responses, a process known as vicarious learning. Treatment for anxiety and phobias often involves psychotherapy, medication, or a combination of both. Cognitive behavioral therapy, CBT, is particularly effective, focusing on altering the thought patterns and behaviors that sustain these conditions. Exposure therapy, a subset of CBT, involves gradual, controlled exposure to the feared object or situation, helping individuals face and eventually overcome their fears. Medications, particularly antidepressants and anti-anxiety drugs, can also play a role, often used to manage symptoms and improve the quality of life for those struggling with these conditions. The exploration of fear, particularly in the context of phobias and anxiety, is a journey into the depths of human consciousness. It underscores the complexity of the mind, the intricacy of its responses to the world. Understanding these conditions is not just about delineating symptoms or outlining treatments. It's about comprehending the human experience, recognizing the thin line between normal fear and its more pathological forms, and appreciating the resilience of those who navigate these challenges daily. As research continues to unravel the mysteries of the brain and behavior, our grasp of these conditions improves, paving the way for more effective interventions and a deeper empathy for those affected by the profound, often crippling, power of fear.